Hi, my name is Tony McDougall, and I am with AssureCore Health and Financial Services. And with me today is one of our great customers, and he's been with us for a while. And I will let you introduce yourself, Bill. Tell us your name and what business you have, and all of that, as much as you want to tell us about yourself.
All right. Thanks, Tony. My name is Bill Sell, and I've been in business almost 30 years with Rapid Rooter Plumbing. I'm with my wife, and we've been dealing with Tony for many years, helping us with our insurance.
Okay. All right. Thank you, buddy. So you've been a customer with us for a long time, and I want to appreciate that. You had Obamacare when it first came out. You and your wife, Diane, had Obamacare when it first came out. And then a few years ago, you changed over to Philadelphia American's indemnity plan, right?
That's correct. We did because for Obamacare, from what we were making and any kind of like cholesterol or any kind of medications that we needed, it just skyrocketed, and we couldn't really, wasn't cost effective for us to go with Obamacare.
Yeah, your premiums were pretty high too, right? Your cost of it?
High. Very high.
Yeah. And then Philadelphia American was a lot cheaper, right?
It was a lot cheaper.
Okay. And you told me a story that I wanted to get on camera. I wanted you to be able to tell it to our audience. And you had a chance to use the Philadelphia American indemnity plan. How did that go?
Okay, back in 2017, around April or so, I overdid something and got a hernia. And so I went to the doctor. I talked to you first, and you told me how to do everything with the new Philadelphia insurance, which I think we had for almost over a year. And what I did was go see my doctor. I paid out of pocket for everything. Told him I wanted to pay out of pocket because it's cheaper.
Right. You got a pretty big discount for doing that, right?
And then they set me up with, when he discovered what it was, because I had no idea what it was, and he set me up with a surgical team here in Concord, North Carolina, up at Northeast, which now it's Atrium. And I met with them, and they, said, yeah, you have a hernia. And they told me how much it was going to cost and all this, and if it was payment plans, blah, blah. And I said, well, this is out of pocket, and what's the best thing to do if I pay up front? And they said, well, if you pay up front, we'll give you that. It'll be like almost 40% discount instead of paying on payments or giving a down payment and then keep billing me. And then, so I did that, and then they contacted the outpatient facility that would be done, that they work with, and they gave me a discount if I paid up front. So I paid up front for that. Then I paid up front for the anesthesiologist. Everything I paid up front, and luckily, we kept our own separate little bank account in case we had emergencies.
Uh-huh.
And so we did all that up front, and of course, then I had the surgery.
Yeah. Do you remember how much it was, the total, or just a round number?
I looked it up. I do keep my records.
Oh, cool. Yeah.
And, with everything paid out, it was like almost $5,800 out of my pocket.
That included the surgeon, the anesthesiologist, everything, the hospital, everything. Okay.
Yeah, the only thing it didn't cover was when they gave me some pain medicine prescription.
Okay.
Local pharmacy, which I didn't bother putting that in there,
Oh, they would have paid that too if that's what.
Probably so, but
But the total cost for everything was about $5,800.
Correct.
Okay.
And then we waited a while to put the claim in case some other bills came in.
Right.
In like April was the surgery, so around June, 2 months later, I want to make sure all the bills you know how slow some of these
Right. Oh yeah.
doctors are. You find one that the actual anesthesiologist, I can't say that word,
Yeah.
you know, they're separate from the facility,
Right.
and they do it by the minute. They charge you by the minute that they had to keep you out. So you really don't know how much it is exactly until you get the bill.
Right. Right.
So we made that payment. Everything was paid. All my bills came in. So we sent all the bills in on June 12th of 2017. Unfortunately, this was the year Houston, where they're located, had a major hurricane. So it kind of delayed all the process, because they had to shut down, and they were shut down. It was flooded. I don't know if anybody remembers that hurricane.
Yeah. Is that Harvey? I think that's Harvey, right?
Harvey.
Yeah.
And then in the first week in September, I received a check for $67.22. So basically, I made $933 by paying up front and not paying all the full costs if I didn't pay up front.
There you go. Good job. That's awesome.
So it worked very well for us. And the main thing is that even if I had to put on credit cards, I mean, that's a 3-month, how much interest am I going to pay on that,
Yeah. Yeah.
Credit card. So it worked really good for me.
Well, that's great. That's great. So for those who are thinking about buying a Philadelphia American plan, what would you tell them?
Oh, go for it. I mean, you never know what's going to happen to you.
Yeah.
My hernia occurred down in Florida. I caught a shark.
Oh, yeah?
I tried to pull it in, and it won. I strained too much.
Oh, my goodness. So did you have to go to the hospital then?
No, because I didn't know what it was,
Oh.
Later on, it kept getting worse, and it's just a weird feeling, so it's hard to explain.
Oh, so that's what caused the hernia.
Yeah.
The shark.
Yeah.
Oh, that's awesome. That's a great story. Huh?
Straining too much to pull him in.
That must have been a big shark.
Yeah, it was.
Yeah. Well, Bill, I sure do appreciate you sharing it with our audience. And do I have permission to share this with the people that are thinking about doing Philadelphia American Health Insurance?
Definitely. I mean, there was hardly any delay. If there wasn't for the hurricane, I know it would have been processed a lot quicker, but they were, desperate.
Yeah.
With all
Yeah.
that.
Philadelphia American is down in Houston, Texas. That's a kind of a silly thing, isn't it?
Yeah.
Yeah.
Yes, I recommend it for anybody. It worked for me.
Okay. Well, thanks, buddy. I appreciate it.
All right. Thank you.